Hi everyone, my name is Liz Dominguez and this project is titled Identifying Blemishes in Skin of Color Education. As many of us are aware, racial inequities exist in both the delivery of healthcare and within medical education. These inequities, along with the inherent racial bias carried by many medical providers, create a persistent barrier to the quality medical care for people of color within the United States. With this in mind, medical training programs have attempted to develop culturally competent trainees through a variety of methods. Unfortunately, previous initiatives have yet to address internal feelings of medical trainees towards people of color. We believe that critical reflection is a method of accomplishing this. In education, critical reflection allows individuals to process their personal thoughts and actions related to complex issues and has been shown to increase medical students' feelings of empathy and compassion. This poster describes the use of critical reflection as a mechanism to investigate and assess healthcare discrepancies based on skin tone, as experienced by current and second-year medical students. In the fall of 2020, all students enrolled in the M2 dermatology course were asked to respond to the prompt, "How is skin tone relevant to the care you provide as a future physician?" These reflections were submitted anonymously using the survey platform Qualtrics and analyzed using qualitative ground theory to determine themes in student writing. We received 248 reflections, and of those, 229 were written, 16 images were submitted, 2 poems, and 1 TikTok video submission. In student reflections, we identified 13 themes, all described in Figure 1. The most common theme identified was personal responsibility. This theme included the idea of taking responsibility to develop one's own cultural awareness through methods such as identifying and mitigating your own unconscious bias, learning about healthcare discrepancies, and advocating for underrepresented groups. Our second most common theme identified was racism goes against healthcare and it needs to be fixed. This theme included the idea that everyone in healthcare deserves to be treated equitably, and in order for that to occur, the current system needs to change. This theme was identified in 151 reflections. Below this in Figure 3, you can see the relationship between all of the themes coded in student reflections, with most people acknowledging the problems with racism in healthcare and few denying that a problem exists. To the right, we have representative written reflections submitted by students, with the top being coded with the themes personal responsibility and compassion, and the bottom being coded with the theme need to fix it. Below this, we have image submissions created by students. Figure 4 is a triptych, which is the same image exposure with different colored overlays in 3 different images, meant to display a spectrum of experiences people have on a daily basis. This image was coded with the theme compassion. And below this, we have Figure 5, classic presentation, which shows a variety of skin tones with a limited range of lighter skin tones outlined in the blue box. Along the outside of the blue box are the titles of many commonly used medical resources. This image was coded with the themes lack of skin tone resources, holding MCW accountable, and a lack of representation leads to disparities. Finally, in Figure 6, we have student feedback regarding their level of comfort with the assignment structure. 77% of students reported feeling at least somewhat comfortable with the assignment structure. And of the 12% who reported feeling uncomfortable with the assignment structure, many of those feared repercussions for their honest reflections despite the anonymous nature of the assignment. In conclusion, common themes in student reflections included that racism goes against the core tenets of medical care, the overall system needs to change, and a sense of personal responsibility to be a part of these changes. Students expressed strong opinions about these topics in their reflections and were relieved to have a space to anonymously process and discuss their perceptions and feelings without a fear of repercussion. Student reflections also showed a wide range of experiences among our learners, demonstrating the importance of being able to process one's own thoughts and actions and understand their role within the larger medical system. Finally, we had a variety of different methods of reflection submitted, showing that reflection looks different for everyone and should not be limited to just writing. Building on our progress with this assignment, we hope to implement additional cultural competency workshops within the M2 dermatology unit, and implement a variety of cultural competency training integrated throughout the entire curriculum. Thank you so much for your time, and I look forward to your questions.